on the NewsChannel 5 network. This is OpenLine.
Good evening, everyone. Welcome to Open Line. I'm Carrie Sharp. I'm sure glad you're with us tonight. We have an important topic to talk about over the next hour, and I hope that you'll join us by calling in, sharing your experiences and your thoughts, or even if you have questions about this topic. What we're talking about is the status of rural hospitals in Tennessee. As you probably know, especially if you watch News Channel 5, because we really have tackled this issue. So many rural hospitals are closing, leaving people long distances to drive when they need emergency care or very serious care. I have two experts joining us to answer your questions, to hear your thoughts on this. Let me introduce you to our experts tonight. We have Michele Johnson, Executive Director of the Tennessee Justice Center. Thank you for being here.
Thanks for having me.
And also Rebecca Jolley, who is Executive Director of the Rural Health Association.
So happy to be here.
We appreciate both of your time. This is such an important topic because a lot of people I know are feeling left high and dry and in a dangerous situation when their hospitals close. First of all, could you all just give me the status of where we are in Tennessee when it comes to these closures?
Absolutely.
You go ahead.
We are at 20 counties right now without any access to hospital services.
20 counties?
20 counties statewide, yes.
Wow.
We've had 13?
Yes, one has reopened, but we're number one in the nation at hospital closures, tied for number one at hospital closures in our nation, which really is gutting rural Tennessee. That's because many hospitals are the number one employer in those communities, and lots of jobs have left those communities as we've had, changes in the economy, and so many families are really struggling. They've been in those communities for generations, and now they don't have a job.
I want to look at the big picture, and I know this did not happen overnight, and I know it's not just one thing that we can just throw the dart at, but why is this happening? Why are we number one in the nation?
Multitude of reasons. One of the things that just brought to my mind and my heart is the BBC just recently came over and did an in-depth story on the closure of the most recent hospital in Jamestown. And one of the things that they found was how there was a historically strong factory base of employment in that town that is dried up and gone elsewhere. And I think that you could repeat that scenario time after time after time. And one of the things that our new governor is seeing when he's diving into our either at-risk or economically distressed counties is lack of significant employment opportunities. Beyond that, we've seen a dramatic increase in the cost of health care. And I think that when you look at access to services without some type of insurance coverage, a lot of times it means bankruptcy for families.
A lot of times, yes. Absolutely. Michele, what do you have to add?
Well, experts have said that in states that did not expand Medicaid, hospitals are 6 times more likely to close. And so while there's lots of complicated factors, we know in states that did expand, those rural communities have factory closings. Those rural communities have hospitals that aren't perfectly managed, but we are 6 times more likely to lose our rural hospital. And that's because the Affordable Care Act, the whole idea of the Affordable Care Act was to get everyone covered, because they knew if everyone was covered, we would lower this uncompensated care, which in fact, hospitals have uncompensated care that they can't live with. They pass on to us as insured people, and if they can't pass it on enough, then they eventually have to close. And so that's what's happened. The Affordable Care Act was supposed to cover everyone. The Supreme Court said, wait a minute, we're going to give governors the choice whether to expand or not expand. And as many people remember, our governor said we want to expand. Our legislature, actually a handful of legislators, said we're not going to do it. And that has continued to play out in our rural communities in really devastating ways. If we expanded, would everything be perfect in those communities or in those hospitals? Not perfect, but it would be perhaps okay enough that we could start to solve some of those problems. And but we just can't. We know, and mayors in the communities that we've talked to, our hospitals have closed, of both political parties say, Expansion is vitally important. It's vitally important for shoring up our community. It's vitally important for saving our hospitals.
So you're telling me if we expanded the Medicaid, more people would have the access to the health care that they need, and it would it had people coming through the doors of these hospitals, and that's where things would start to change.
Right, it would cover about 300,000 Tennesseans. Many of these are waitresses and construction workers and home health aides. These are people working really hard, but they don't make enough money to qualify for Affordable Care Act subsidy. So they're going without coverage, and if they get in a car accident or they break an arm, they end up at the hospital and unable to pay that debt.
Yeah, they can end up in bankruptcy, as you pointed out. I want to remind you, this is Open Line. This is your chance to give us a call, to have your questions answered. If you've been thinking about this, to tell us your story, if you've been dealing with it, the number is at the bottom of the screen. 615-737+ is the number to call. I wonder if you could pinpoint when this started. Is that possible?
Well, it's definitely, there's always been challenges for rural hospitals because, in fact, there's not a huge amount. Obviously, there's less people, right? So getting a steady amount of business and getting providers to come there and work there, it's never been easy for rural hospitals. But kind of the epidemic of rural hospital closures, I think, started about 3 years ago. The Affordable Care Act was built on a financial model where hospitals gave back money to basically make sure everyone was covered. So they gave back money because everyone was going to be covered. They wouldn't have uncompensated care. But then in our state, we continued to have growing uncompensated care. And so those hospitals started falling about 3 years ago. And once one falls, it's a domino effect with neighboring hospitals falling next and next. Well, because those people who can no longer rely on that hospital go to the next one and the next one, and so you have just a line in rural West Tennessee and a line in rural East Tennessee where one falls and then the next one and the next one.
Because people are going without the coverage that they need to pay the bills, and so we have hospitals providing services that they're not getting paid for.
Well, and then people are just going further to get that care, but they're also not able to afford it. So you just have a wider swath of people that are relying on that hospital than they ever were intended to. And many of these hospitals are really just stabilizing people to send them to the next facility. But what we found is without that hospital to stabilize people, the ambulance can't make it to the next hospital. Sometimes they can't even make it when someone wants to donate organs. We had people tell us moving stories about their hospital's key because it just enabled people to donate their organs, to get to save those organs, to get them to to a larger facility. But without those rural hospitals, it is, it's devastating.
Yeah, I would say, and not just devastating for the patient, which obviously has to be the number one, but I've read devastating for an entire community because often these hospitals are the biggest employer in town, and then they disappear, and you've got a whole lot of people on the unemployment line, right?
Exactly.
So I would actually go beyond that. Our rural hospital closures actually started back in 2010. That's when we really started seeing our first significant amount of closures. And
what do you attribute that to?
I really do attribute it to the lack of employer-based coverage. The significant amount of jobs lost in rural communities. Our rural communities are very proud-based communities, and they don't often look at the government as a solution. And they still don't look at the government as a solution. And I agree with Michele that I think that expansion of Medicaid would help, but I don't think that it's the end-all be-all. I feel like driving back strong economic reform, strong economic jobs into our rural communities that used to exist is the pillar for stabilizing our economy statewide and providing strong basis for access to care.
Let's go to the phone lines. We have Marie waiting on the line. Hi, Marie. Thanks for being the first call of the night. Go ahead.
Hello?
Hi there, Marie. Go ahead.
Yes, my comment is in regards to the expansion of Medicaid. The factor is the federal government was only going to pay for that for a certain amount of time. Then the burden will eventually fall on Tennessee. people there, and that's going to be really difficult for the people in rural Tennessee. So it's not just one issue of the hospitals closing, because there's a whole issue. It could end up on a state tax for the people in Tennessee. The second part is a lot of these rural communities need an extreme ER center so that somebody can go to. Just enough people to cover the ER center, and then you further the people on to an appropriate hospital. Thank you.
Thank you, Marie. And I think Marie brings up great points. I've even read that a lot of the issues with these hospitals is advances in medicine. We don't have people staying, multiple days for certain surgeries anymore, so it's freeing up bed space, which also means
So true.
fewer dollars are being spent.
No, not fewer, different.
Okay.
Different dollars are being spent. I literally just came here from, I don't know which camera to look at.
You can just, there you go.
I'm going to look at you.
That's perfect.
I want to make sure I connect with the audience. But so I just came here from the Telemedicine Regional Resource Center. They have a multi-state collaborative looking at the access to care through telehealth, telemedicine. And it's revolutionizing the way that we have historically thought about accessing care, but it also makes a lot of sense as it relates to the busyness of our schedules, the inability of, oh my gosh, I'm a mom, and it's hard getting my kids to out of school,
Yes.
and where they need to be for their dental care, their primary care. If I can do that through telemedicine and through my phone and have that just child care
Yes.
developed, it's so much more convenient and accessible and meaningful, honestly. And then when you relay that out into our rural hospitals and our rural communities, one of the things that I put up earlier today as a speaker on a panel was our health professional shortage areas. And a lot of our rural communities, they lack access to the vital care that you and I think of as
Just around the corner.
When we're here in Nashville. And our rural areas lack that, and having that ability to access it in a meaningful way through a touch point that may be unconventional but still accessible.
I just
want you
want
to chime in
to
too.
comment on Marie's point, which was she's concerned about the cost. We're a state that doesn't have an income tax, and that has really, the people of Tennessee have said very clearly they don't want an income tax. So how do we afford this? Well, the federal government knew that in order to get expansion, in order to have health care cover everyone, that they had to basically pay for all of it in the first years, and then go down little by little until it ended up at 90%. When Governor Haslam proposed the plan, the Hospital Association offered to pay for anything that the federal government didn't pay. So basically, we would have netted this as a state. We would have covered 300,000 people, and we would have netted money. If the Hospital Association is still willing to do that, and of course, they're losing their members are losing money. So if they're still willing to do that, we seriously could cover 300,000 people and net hundreds of millions of dollars. We've done the calculations, hundreds of millions of dollars we would be making money as a state, because the federal government is making investments in our state. Right now we've lost $7 billion, $1.4 billion a year in federal funds that are just sitting in Washington. Well, I talk to people who are waitresses working 2 jobs who have chemotherapy that they can't have, and their elected officials refuse to go and get what is needed for them to access those dollars because of politics. And so
I would say, if it makes sense on paper, if you can say, here are the numbers, why aren't we doing it?
it's about politics, and healthcare has become such a political issue on both sides of the aisle that it's just a shame, because we have people who really don't go into hospitals as Republicans or Democrats. They go into the hospitals as mothers and as daughters, and they really want leaders who can roll up their sleeves and deal with these complex issues, none of which are simple. It's just we need our elected officials to park their own political interests for a minute and take care of the needs of Tennesseans and rural Tennesseans particularly.
All right, we're going to keep digging into this issue. We have a lot to discuss in the next 45 minutes. We'd love for you to be part of the discussion. The phone lines are open. 615-737-PLUS is the number to call if you would like to weigh in on why rural hospitals are closing and the impact it's had on your life. We'd love to hear from you. Stay with us.